Namaste, I am Dr. Asha Baxi, Lead Consultant at Motherhood Hospital, Indore and Secretary General ISAR 2024 to 2026. We have many questions in the field of infertility, and these questions will be answered by our ISAR members from all over India. So friends, let's begin micro-learning in infertility. So the question is, what is the role of stem cells in ovarian rejuvenation and how to do it? So I'll be asking this question to young Dr. Rudri Patel, who has recently presented this paper in Fertivision conference and got the best award. She has been fellow in the infertility, and at the same time she is practicing infertility in Nova IVF.
Hello everyone, myself Dr. Rudri Agrawal, IVF consultant at Nova IVF. So before I begin, I would like to express my sincere gratitude towards Dr. Asha Baxi ma'am, whose visionary leadership and mentorship has been a constant source of motivation and inspiration for all the young clinicians across the India. So thank you so much ma'am for discussing the very important topic today, that is ovarian rejuvenation and stem cells. So as we all know that a woman is born with a fixed number of oocytes, and this ovarian reserve declines with age, sometimes due to iatrogenic reasons like ovarian surgeries, and sometimes maybe due to chemotherapy. So the concept of ovarian rejuvenation is based on this idea that can we do something to reactivate the dormant follicles present in the ovary, and here comes the role of stem cells. Stem cells do not create new follicles, rather they try to activate the dormant follicle present in the ovary, and they do it by the paracrine mechanisms, by the release of growth factors and certain cytokines, which helps to improve the ovarian blood flow. They may improve mitochondrial functions, sometimes they improve the granulosa cell activity, and sometimes they increase the sensitivity of the follicle towards the gonadotropin when we try to do our IVF cycles. So the aim is not to create the new follicle, rather to rescue and activate the dormant follicles present in the ovary. And if we talk about the techniques of ovarian rejuvenation, then we have in the basket the autologous platelet-rich plasma, the stem cells derived from the bone marrow, and the adipose tissues. All these techniques, however, are in experimental phase, and they need the large randomized control trials and the robust evidences in the human subjects. So a very important consideration is to choose the correct group of the patient in which these therapies can help, and to set the realistic expectations and a proper counseling to the patients that these therapies are still in the experimental phase, but at least they can be tried when we do not have any hope. So thank you so much. So before I conclude, I would like to express my heartfelt wishes for the upcoming elections for the second Vice President ISAR post. All the very best to respected Dr. Asha Baxi ma'am. Your dedication and leadership has always inspired us to do our best. The entire IVF fraternity firmly stands with you and firmly supports you. So thank you so much ma'am for inviting me today, and all the very best for your all future endeavors. Thank you so much.
Thank you very much for an excellent answer, and I'm sure it is going to be helpful for lots of our colleagues. Friends, I take this opportunity to request you all to support me wholeheartedly for the upcoming election of second Vice President ISAR from the year 2026 to 2028. Thank you very much.